Hi there. Today I am going to be talking to you a little bit about dentures and the wonderful advantage and life-changing differences that implant support can provide for denture patients. So traditionally, dentures are reserved for patients that are missing teeth, and once all the teeth are missing, a full denture is provided as a prosthetic device. And this is a point that patients often don't realize going into it, is that a denture is a prosthetic. So think of the analogy of a prosthetic arm versus your real arm, and what you can do with your real arm versus a prosthetic. Obviously, prosthetics in terms of arms and limbs have improved over the years, and that is also true for dentures. Traditional dentures normally just sit over the bone, they saddle over the bone in order to stay stable in the mouth. However, bone loss is a consequence. Sometimes it is experienced in lead up to tooth loss, and oftentimes it's continued to be experienced after tooth loss, especially with the continued use of dentures. So as an example, here we see a lower denture, and with the lower denture, we have a cutout space for the tongue so that a person's tongue can freely move across this area uninhibited. Whereas an upper denture would normally have this area between the teeth covered in order to fit along the palate, the roof of the mouth. That's an area of bone that doesn't generally change shape, not to the forces of denture. And so that area along the roof of the mouth, the palate that's normally filled in on an upper denture, provides additional stability and support for denture patients. But unless there is a ridge of bone where the teeth used to be for the denture to saddle around, then that without that bone ridge, dentures will be unstable, unfortunately, because what ends up happening is interference of the cheek and lip muscles that basically will pull the denture out of place as a person opens their mouth to speak, to chew, to basically go about the normal actions that we are so used to with our mouth. And so as a patient or person opens up wide, those muscles stretch, especially along the inside where that denture is trying to saddle and stay still. And so that tissue then pulls the denture up out of place. And that's what can create an unstable denture experience for patients. All that tissue movement around the edges of the denture, pulling the denture out of place and causing it to not sit stably in the mouth. And so that then basically takes away any ability for a patient to chew efficiently, let alone speak and interact with others. So the other thing to note is that basically wearing a denture on bone year after year over a long period of time can also contribute to bone loss. Perhaps you've seen some denture patients that have a very sort of sunken in look to their facial structure, that sort of thing, because they've over time lost bone. And so I'm going to show you two examples here. So this is an example of a lower jaw that is losing bone over time. So the first example shows the jaw with teeth and how the jawbone is normally surrounding those teeth and supporting those teeth. With tooth loss, it's not uncommon to experience a little bit of bone loss, In such a case, there's oftentimes still enough of a ridge for the denture to sit and saddle around and be stabilized by. However, over time, that ridge continues to shrink, getting thinner, and also getting shorter. And in extreme cases can get very short, where basically the gums are at the same height as the muscle tissue that's connecting the lips and the cheeks to that remaining bone. And in those situations, stability of a denture is nearly impossible with traditional adhesives and that sort of alternative solution. And so just trying to wear dentures when bone has been lost in such case makes for a very miserable denture experience. I'm going to show you an example of the upper arch, the top part of the mouth. And so here, similarly, we see the effects of bone loss over time, where that ridge continues to get thinner in width and shorter in height over time. And so again, we can see how these ridges are becoming thinner over time and also shorter. And so upper dentures tend to be less problematic for denture patients than lower dentures because, as I mentioned earlier, the upper denture, we have the roof of the mouth, the palate, as an area of bone that doesn't necessarily change shape as does the ridge where the teeth once were. And so upper dentures tend to be a little easier to use. Patients can usually put a little adhesive on the denture along the palatal area, and that will help in terms of keeping that denture in place, at least for appearance, if not also sometimes for functionality in terms of chewing with the denture. And so these are some of the limitations when it comes to anatomy and stability of for a denture. The other thing that I will mention is that when a denture is not supported by any implants, when it's only supported on the ridge of bone that it sits on, there are other sort of limitations to how a person can function with this denture. Denture patients have to adapt to a new way of eating when they are using just dentures by themselves. And the reason for that is certain forces that we're used to putting on our natural teeth can cause also instability for a denture. So with our natural teeth, we are very accustomed to taking a incisal bite, a ripping bite with our front teeth and doing chewing mostly in the back. And so that tearing, ripping bite with a denture can create instability. So if you see here, I'm going to put pressure on just the front teeth. So imagine this is a patient's denture and they're trying to bite into an apple or even something softer like a sandwich or what have you. And that pressure all on the front teeth, even with the upper front teeth there, will cause a rocking instability front to back. Okay. And when we are eating with our natural teeth, we normally move food from side to side in a sort of rotating action, chewing a little bit on one side, moving the bolus of food, that, clump of food to the other side, doing our chewing there, and just kind of rotating around the mouth, going from side to side to chew our food efficiently. With the denture, that too can cause instability in the denture. So here I'm going to show an example where we're putting force only on one side or only on the other, and you see how that causes the denture to move around. If you've been wearing dentures, you have likely experienced these problems As I said, sometimes using adhesive under the denture can give enough stick to counteract some of these forces. And then the other factor is, as I have noted, is the ridge of bone, the bone that the denture can saddle around. If the denture can saddle around a very tall height of bone, then that is going to make for a more stable denture experience. But as that bone shrinks away and becomes more and more shallow in the mouth, then the denture is also going to become more and more unstable and kind of float around looking for stability because it no longer has a ridge to be stabilized by. So, with all that, the game changer for prosthetic dentures is implants. So with implants, we can then clip the denture into place on something that's already embedded in the jaw bone. And by doing so, there are multiple advantages to be had. First and foremost is stability. So this is an example of a denture, and this is an example of a ridge with implants. What you see here are what are commonly referred to as mini implants. For reasons that I can explain, I'm not the biggest fan of these minis. I've seen a lot of failures of these sort of implants, and so I prefer traditional full-size implants as opposed to these minis. But for demonstration purposes, this will serve us well. And so basically, this is imitating the ridge of bone in the mouth. We have the implants that are embedded into the bone, and then sticking out above the gums are these little attachment points that line up with attachment points in the denture. This allows the denture to be clipped into place and stay in place securely and without the use of adhesives or anything like that. Here, putting pressure on those front teeth and they are stable in place. Putting it on side to side and we see that the denture is still stable. So, implants are a game changer for stability of dentures. By having the denture so stable, it actually then allows you to have a much stronger biting force. When things are held in place, you can bite much more strongly and tear through foods and enjoy your meal much more easily.